1 in 5 adults experience some form of mental health condition in any given year. 1 in every 20 adults live with a serious mental health condition. This data coming from the Florida chapter of the National Alliance on Mental Illness. The Ad Council says that breaking the isolation where that mental health problem can grow and intensify is really the first step in a really good direction.
How are you feeling?
You know, I just been kind of
I guess, you know, like, I appreciate you listening.
And that spot is from the Ad Council. It's called Let's Be Real. Sharon, I'd like to bring you into the conversation. You have often said that the Employee Assistance Program saved your life. Tell us about how you convince companies and associations that the EAP is not a throwaway, is not a luxury benefit for the employees.
Well, the EAP actually did save my life. It is a fact, and not just mine, but my entire family's. So my father was a boss at New York Hospital, and I was in a horrific place in my life. I was addicted, and at the age of 19, after 2 rehabs, a halfway house, I blacked out and woke up in another state. So it was very serious. I was homeless and addicted. My father was a boss and had to go to work every day and lead his employees. So if he did not have this EAP, Ben, to go to every day to speak to about what was going on with his daughter, because if you could imagine having to lead an organization and not know where your child is, it must have been so harrowing. So then I got sober at 21 years old, came back, and my father knew me so well, and he said, you know, we're a lot alike. He said, you know, I think you would really love this EAP that I was seeing. And if it wasn't for Ben Figueres, who I love talking about, he was the first and the bravest to ask me if I was having suicidal thoughts. So at 21 years old, I'm 53 now, so I'm sober for 31 years and have dedicated my life now to having these conversations, so I really appreciate them. And what I notice in these workplaces, because I have been a boss for many, many years in New York and then here with large medical operations, and what I've noticed is that the EAP comes up maybe when we are coming into November, when we're talking about our health benefits. And it's kind of hidden, you know, and it goes really quick. But I really think that if employee assistance programs were explained and what the benefit was and how there should be no shame around it. And I think that, you know, there's a lot of people, and understandably so, that are in fear that if they use an EAP that their boss is going to find out and they're going to say, oh my goodness, like they might think that they have access to the notes. They have absolutely no access. It's all confidential. But we need to talk about it more than during the open enrollment, and also during what I like to call the hashtag months, you know, mental health awareness, suicide prevention. I think that we need to talk about it every month.
When you are speaking at the conferences and when you are speaking before groups of professionals in a certain industry and they say, we have EAP, not a lot of our employees use it, why is that?
So I have spoken at these, and this has exactly happened, and maybe there'll be an HR representative that gets up before I get up, which is smart, actually, to say that they have the EAP, and then I will be signing books, and they will go, oh my God, Sharon, I never knew we had it. And it is nobody's fault.
Wow.
Well,
that happens often?
All the time. This morning.
That's shocking.
I know, and that's why I'm so grateful to have these conversations. So it really is exposing something that we all need to talk about. If we're I'm not a big fan of the word stigma. The only way to normalize a conversation around mental health is to have these conversations, because we're not talking actually about mental illness. We're talking about mental health. I'm very proud of the fact that I have great mental health. I have a therapist. I have an appointment at 8 a.m. tomorrow. I love telling people about my therapist. I love talking about how I take care of myself mentally, and exactly what you were talking about with people being uncomfortable in this silence. You know, listening is not waiting for our opportunity to talk. So if we're going to be great leaders, we need to be able to listen. So the leaders need to be taught how to have active listening skills. We also, as leaders, need to learn how to stop, take a breath, observe our thoughts, and proceed. So we have to be a little more responsive than we are reactive. And part of that is not shifting blame on anybody, because the EAPs aren't talked about a lot, and not every company can afford an EAP. But there are certainly so many great programs like the Crisis Center, like the Veterans Line, like Alcoholics Anonymous, like all of these free programs that are not brought to light, like NAMI, which is the National Alliance of Mental Illness. We have so many nonprofits.